Good day. My name is Sizwe Ngasana. I'm the chairman of the Bongani Mayosi Foundation. It is again a pleasure to partner with UCT as we celebrate the second 2022 UCT Bongani Mayosi Memorial Lecture. It's become a very important event on our calendar, especially because we invite a number of eminent speakers to talk about things that are topical, especially that affect the health of our communities. Last year, we announced that we had embarked on a process of selecting those people who had participated particularly well at medical schools in not only academic excellence, but also showing public service. This year, based on the nomination process that happened in 2021 towards the end of the year, we are very pleased to announce some of the winners from all the 9 medical schools of young people who've now qualified as doctors, who have demonstrated academic excellence as well as public service. All 9 medical schools, including UCT, Stellenbosch, Walter Sisulu, Free State University, Wits, UP, SMU, Limpopo University, and UKZN, participated in this process of selection. The Bongani Mayosi Foundation continues to focus on some of the programs that are really important and are in line with those things that Bongani Mayosi was passionate about. Those include addressing the issue of mathematics in schools, as well as the intercalated program which is currently run at UCT. Of course, there are a number of initiatives, particularly at UCT, and we are very honored and thankful for the partnership that we have with UCT, as well as with all the other funders and donors that have supported the initiatives of the Bongani Mayosi Foundation. I thank you.
Yo, safakali sijwili. Iyehande fama yem namahem. Kuthoni na sakuqubana inhliziyo. Kuthoni na sakuqubana imvakalelo senhliziyo. Hayi sisixaka ngqondo nophefumulo. Khatebe. Mashobatha wena washobathela inkomo nempondo. Mafuza fulele. Wena ufulela izulu ngezembe. Njengoba abanye abantu befulela ngenqanje wena ofulela ngezembe ngobuhaha bakho. Ayabonga ayabulela amawethu. Ngomsebenzi ongako wenzileyo. Ayabonga ayabulela amawethu ngobuchwepheshe nobugorha bakho nezenzululwazi kwezempilo. Jongilizwe ulijongile ngokwenene. Awukhange woyike ngokoyikiswa. Lifula mvula hlube lihle sawuzawu bhuqwa mnyama nozipho ngoqhwayana. Nanku umsebenzi wezandla zakho Khatebe. Nasi indwalutho siqeqeshwa zihlohlwa sihlolwa kukwenza kwakho mthimkhulu nokuba sisivile isithonga sokuwa kwakho. Bongane ndlebe enhle zombini imisebenzi yakho isabonakala. Ezo ndlebe ziseva nangoku zombini izinqi zakho zisavakala. Izizwe zonke zisondelelene zihlanganiswe nguwe Bongani. Omncinci nomdala uyaxhamla uyanyukela kumfundo ephakamileyo. Dlezane nombelo omde dlikidla bemhlasela uyokuhlala uwongwa kwele mimoya uyokuhlala uwongwa nakwele nyama. Nqonqwada nakulomsitho Khatebe. Ngena ubukele ucebise kunye nokhokho bethu kwele mimoya. Nokuba ngathi awukho kodwa usekhona. Nokuba ilizwi lakho ngathi livakala kodwa liyavakala. Ngena uphumule uhlala ngoxolo ungena khala kulomsitho. Mfoka Mayosi. Desithe.
Professor Bongani Mayosi, insightful researcher, clinician, leader, friend and devoted family man, was born in Mthatha in the Eastern Cape on the 28th of January 1967 and died in Cape Town on the 27th of July 2018. He had the capacity to create the vision of a world of justice and equity far beyond our limited imagination. His immeasurable legacy continues to inspire people throughout the University of Cape Town and across the globe. Professor Mayosi made immense contributions. He transformed the Department of Medicine at UCT to become the largest and leading medicine department on the African continent. He also made it more inclusive, inspiring many young trainees, especially Black students, to become academics. He trained several cardiologists and other specialists emerged from his department. As a researcher, Professor Mayosi was a global leader in his field and a doyen of heart-muscle disease on the African continent. Professor Mayosi's discovery in 2017 of a new gene that causes sudden death in young people was considered one of the most important medical advances made by a South African scientific team since the first human heart transplant. He was passionate about building a better understanding of cardiovascular disorders of the poor. He deepened the understanding of heart failure and HIV-associated heart disease and gave new prominence to the challenges posed by tuberculosis pericarditis, which is a TB of the outer membranes lining the heart. Following over a decade of research in rheumatic heart disease, Professor Mayosi was at the forefront of bringing global attention to a disease that affects mostly the poor, landing it on the agenda of African institutions, the World Health Organization, the World Heart Federation, and the United Nations. He published over 350 peer-reviewed articles and book chapters during his lifetime, and some have emerged posthumously. Many of his papers have been translated into policy and adopted by global organizations. He also made important contributions to the strengthening of health systems in South Africa and other African countries. A seminal work contributed to a greater understanding of the role of the clinician scientist and the importance of growing this cadre in South Africa. Professor Mayosi's impact on the institutions he led was far-reaching. He won numerous awards and accolades, including the National Order of Mapungubwe Silver in 2009 and an A rating by the National Research Foundation. He is widely remembered for the positive effect he had on people everywhere, encouraging self-belief in his colleagues and students, many of whom excel in their fields today. Professor Mayosi's colleagues say they'll carry his life lessons with them wherever they go. A favorite saying or Bonganiism that they speak of is "lift as you rise." This was his call for colleagues to help build capacity, mentor, and create opportunities for others as they grow and succeed in their fields and studies, thus promoting African excellence. He lived what he preached, and it is no surprise that Lift as You Rise is a theme underlining initiatives developed to honor and build on his legacy. Our partner host, the Bongani Mayosi Foundation, was established by his family to honor his legacy by fostering the academic, research, and training programs about which he was so passionate. To honor Professor Mayosi's legacy, the University of Cape Town dedicated physical spaces on its Faculty of Health Sciences campus in his memory. The library has been renamed the Bongani Mayosi Health Sciences Library. The passageway alongside the library and the link bridge with Grooteskier Hospital houses a celebratory exhibition of his work and the values that he epitomized and much loved Bonganiisms or sayings. The university also established an annual UCT lecture in his name, an honor bestowed only on an individual of the highest standing, and so institutionalizing the legacy of Professor Mayosi. These UCT annual Bongani Mayosi Memorial Lectures are inspirational and serve as an annual gathering in celebration of African scholarship. They foreground African science and celebrate Africa's scientists and their excellence. They aim to showcase approaches to the needs of Africa that will inspire scholars to realize the dream of finding African responses and solutions to Africa's needs and the social determinants of health. The UCT annual Bongani Mayosi Memorial Lectures will be given by distinguished individuals from across the world, whose work embody the ideals that Professor Mayosi espoused and his unfailing commitment to equality, social justice, transformation, and excellence in the pursuit of knowledge.